I am talking today about sleep. And there's a reason behind this. We were recently talking in our Health Seekers group about sleep and certain tips around it. And it comes up every day in the fellowship training I'm doing. Almost, I would say every other patient we see, there's some kind of trouble with sleep. So I thought it'd be great to come in and talk a little bit about, what is a sleep problem versus what's a sleep disorder, because there are medical disorders that lead to sleep issues. So thanks you guys for jumping on. If you have ever had trouble with your sleep, or maybe it's becoming more of a problem, there's actually things at the root that could be causing it. And it may just not be as simple as, you just have sleep apnea or something along that line. So let's talk about the fact that there are about 50 to 70 million Americans that have some kind of sleep disturbance or disorder that affects them often, like most nights of the week. So what's considered to be a chronic sleep problem is if you have trouble going to sleep or staying asleep most nights of the week for over 2 weeks. So when that's the case, you probably want to see a sleep specialist. And I'll go a little bit more into that and how to even go about that if you're not familiar at all. So since about 27% of Americans most nights have trouble with sleep, I think it's important we just kind of open up the conversation. There's no shame in not sleeping well. It seems to be something that's getting worse and worse and kind of permeating society. And that's probably linked a lot to stress and other things, but let's move forward with that. So sleep disorders are things like narcolepsy, where people literally cannot stay awake during the day, or they're sitting in a chair and they literally kind of nod off. That's actually a sleep disorder. And then obstructive sleep apnea is something that's also a disorder where there's anatomy that is happening whether it's the tongue falling back in the throat, maybe someone's overweight, or there's something with the obstruction of it while they're sleeping, which cuts off their airway. So, like that kind of sound or something similar. And then they either wake up or someone next to them is hearing them do this. And so that's like an obstructive sleep apnea. There's also restless leg syndrome, which is, it can be both legs. It can be one leg. It can be sometimes. It can be often. Restless leg syndrome is also something that's more of like a disorder. And insomnia, which is probably the one we're all most familiar with. Insomnia, they say a third of all adults report some kind of insomnia. And so one thing that we have often recommended too in the practice is for people to go get a sleep study. I know it's kind of weird, like you got to go to a place usually and spend the night, but if you can find a good place in your area that is comfortable, it's usually very welcoming and warm. And the reports that we've gotten back from local places, at least where we are here in Naples, have been that people were really comfortable there. Yeah, it was kind of strange to go somewhere and sleep for the night that wasn't home, but it was totally worth doing to check off some boxes of, no, I don't have actual sleep apnea. No, I don't need some kind of machine to help me. But you kind of need to find out especially if it's been going on for a while, you want to check that box off that there's not an actual disorder behind it. Now, you can actually still just have sleep problems, right? So even if you go to get a sleep test and they maybe they see that everything looks healthy, you seem fine, then you're probably still going to have a sleep problem, which is what I'm going to focus on today, because I think that a lot of times, certainly the sleep specialist can take care of the part of, just making sure there's nothing physically wrong. But let's talk about sort of kind of what I call the mental aspect of it. So, you can't fall asleep or you can't stay asleep. And sometimes this can be because there is an underlying condition going on. So in functional medicine, they're going to look at, is the thyroid contributing to this sleep problem? Is it anxiety, depression, arthritis? When your joints are inflamed and you're in pain, it can be hard to sleep, right? Or stay asleep. Asthma is another one, so any sort of breathing issue. And then, like we talked about earlier, the restless leg syndrome. And so if they say that about 2 out of 5 people don't get at least 7 hours of sleep, we know that there are a lot of things that are keeping people awake or waking them up in the middle of the night. And this can go back to stress in general, but you always want to make sure that you're not just medicating to cover up the symptom or to get the short-term relief, which I'm sure initially that's a fine concept, but for long-term, it's really not. And this is where I want to talk about conventional medicine, because, you know, I practiced as a PA for 13 years, and the majority of it has all been conventional medicine, where we look for symptoms and we treat symptoms, but we don't always dig under to find the root cause of things. And so when you go see someone and you're having trouble sleeping, oftentimes we would recommend, you know, whether it's primary care, urgent care, wherever it would happen to be, you could try things like there are over-the-counter sleep aids. They're very popular, actually, because now that we know that 2 out of 5 people have trouble sleeping, we know why they're so popular to have these things on the market. You know, Unisom, Benadryl, Tylenol PM, Advil PM, all of these things that can kind of help someone get to sleep. And then there's the prescription drug market, which is Ambien, Roserum. There's other, often people will write benzodiazepines like Valium for sleep. And here's what I want to mention about this. You know, I'm not here to judge that we shouldn't be writing these at all, because they were designed to be written for 6 week intervals or less. So the idea of these prescription drugs, when they came out to market, especially when we're talking about Ambien in particular, was for a patient to use them for less than 6 weeks, to not use them for ongoing. It was not designed. Hey there, I see you guys jumping on. Thanks so much, Darcy. So I'm talking about sleep today and kind of going over a little bit of what conventional medicine does for sleep. We talked a little bit about perhaps getting a sleep study, which can be really helpful to make sure there's nothing structurally going on with someone that's, you know, complains of not being able to get to sleep, or when they are asleep, they wake up and then their mind starts going, and they can't get back to sleep. So back to Ambien and Valium. Why do we even care if people use it long term? Because here's always been my thought as I practiced medicine was, and no harm, no foul, right? Like if it makes someone feel better, you know, the short-term goal is there. Like, is there any long-term repercussion? Well, there actually is when it comes to taking Ambien, Valium, these kind of sleep aids at night. And when they looked at people that had taken them longer than 6 weeks, there are some long-term health effects. Long-term use of them can lead to digestive issues. You know, we've talked a lot about, you know, my own digestive issues that came up over time. This is certainly a real issue when taking these kind of medicines. You can develop more digestive issues, increased fatigue, ongoing headaches. They talk about lightheadedness, dizziness, dry mouth. It just, the side effect list was like really long, taking these things for long term. So in functional medicine, we're kind of looking at, okay, if you have a short-term result of maybe you had to get some Ambien because of whatever, something stressful was going on, but how are you going to exit out of that? And how are we going to figure out what's going on underneath the fact that you can't sleep? So when they're looking at the root cause, like stress, you're going to have to do other things besides just take a pill. And it's probably going to have to turn into a routine. So basically, you want to make sure you're scheduling your sleep. So in bed by, you know, 10, 11 at night, waking up 6, 7 in the morning, however that looks for you. But ideally, you're getting around 7 hours is what a lot of the experts talk about, roughly 7 hours. Now, I was reading that Einstein slept 10 hours a night. So I don't know, go figure, right? And then I know there are plenty of successful, high-functioning people that sleep very little hours, and that's just their body's rhythm. But if you're trying to sleep and you want to sleep and you can't sleep, that's where the disconnect comes, right? Because if you're laying in bed and you want to be asleep and all you are is awake, that's a big disconnect for you, and it causes a lot of anxiety. So here's a couple other things you can do. You can get some sunlight for about 20 minutes a day. So just going outside, getting a little bit of sunlight. And you know I have a huge dermatology background, so I'm not saying we need to go outside and try to get a bunch of skin cancers and keep the dermatologist busy. We just want to get enough to, like, we're getting some activation going on of the vitamin D and other things that it releases. Looking into bright light, especially if you're traveling and you're off time, looking into the sun a bit, obviously with sunglasses, can and help with your normal circadian rhythm too, and help adjusting that. So they talk about an acupressure mat. That's something else that people can use. I haven't used an acupressure mat. I can't tell you for sure if it helps or not, but I would think if I was struggling with sleep, I might try a lot of different things before continuing on prescription medicine. Grounding techniques, that's where you can walk around barefoot outside. Usually you got to at least be on concrete, but it's the whole idea is that you're outside barefoot on the earth. Sounds a little wackadoodle. Trust me, when I first heard it, I thought, what is this? But it actually makes sense. And if you're interested, I could share with you a cool video on grounding. We've shared it in the Health Seekers group, and it's pretty enlightening. Now, things you can take orally that we start with magnesium in our clinic. So magnesium citrate or glycinate. You don't want to just go buy any old magnesium at Walgreens or wherever. You want to make sure you're looking at the bottle and it says magnesium citrate or glycinate, because you want it to be an activated form of a supplement, not something that's just going to go in and go out. So you're talking about starting at 200 to 400 milligrams. You could take this at bedtime. And then other things you can take would be L-theanine, calcium, and let's see, what else do we have in here? Herbal supplements like passion flower and valerian root. So the doses on what I have down doses wise for these herbal, so these are herbals, right? You're buying these as supplements, and ideally through a reputable source and someone that is using pure ingredients, because that's a whole other topic on its own. But if we're talking about valerian root, for example, they recommend 320 to 480 milligrams, and then the passion flower is 300 to 600 milligrams. Light stretching and yoga before bed can be helpful. And let's talk about a red light. I thought this was so cool. This came up the other day in clinic where a patient was saying she'd wake up in the middle of the night and wanted to maybe read something or thumb through something to go back to sleep. And we started talking about red light. So a red light bulb can give you like the light you might need to kind of maybe thumb through a magazine. Obviously, you don't want to be studying something or reading something that's very thought-provoking, because that'll just keep you awake. But if you need to get up and do something like the red light seems to have less interference than if you turn on, a regular bedside table. So I thought that was a great tip. Unplugging 2 hours before bed. Oh, I'm so guilty of this, like not being on the computer, iPad, phone 2 hours before bed. If you're having issues with sleep, getting that light from away from your face is really key. Other things that you probably want to check for if you're okay. So say you went and you saw your practitioner and you started some of these supplements and you're doing okay, but you're still not sleeping like you'd like to. What else would we dig for? Things like food sensitivities can cause sleep disturbance. Thyroid issues, menopause, perimenopause, hormones are a big thing. I'm actually doing the hormone module right now in functional medicine, and there's like everything, every symptom you can think of that a woman could possibly have could be happening because of our hormones. So it's pretty incredible. So checking your hormones. If you already have fibromyalgia or chronic fatigue syndrome, you probably want to see how well that's being controlled, and maybe working on that underlying condition can help the sleep be better. Checking for heavy metal toxicities. I'm always surprised. I didn't really understand this heavy metal toxicity thing, and I thought maybe this is a bunch of hooey, like I don't get it. But the more I'm in and listening, we get all these exposures through a variety of different things. And if you have a heavy metal toxicity or a buildup in your body, it can also affect a lot of things like sleep. So one of the things we'll do is we'll check for heavy metals to see if that's contributing at all to someone who's having a lot of trouble sleeping. So that's a good thing to get checked. And then, of course, depression, anxiety, trying to control that better will help sleep be better. So what are some integrative? So we kind of ran through the functional, and before we wrap up, I want to go through some of the integrative, like, I guess some people might call it alternative options that there are. I mean, people use acupuncture to help with sleep. They'll go see someone who's maybe a doctor of acupuncture. Neurofeedback is something I'm hearing more and more and more about. They're using neurofeedback a lot for all sorts of brain issues, but for sleep in particular, it can also be an option. So neurofeedback, and then essential oils. That's something that keeps coming up, of course, from, again, a reputable source, a pure product, not some junk somewhere, but using essential oils, breathing techniques. There's so much in the history of, especially Eastern medicine, that getting control of the breath. I think Dr. Andrew Weil says if you can control your breath, you can control everything that's going on. So I think breathing and breathing exercises can be really helpful. And actually, one gal in our Health Seekers Challenge that we currently have going on, she has had a lot of trouble with sleep, and her breathing, she says doing the breathing exercises and kind of going through more intentional breath work has really changed things for her. It's even helped. She was having some spasms in other areas, and it's helped. So we kind of dig into that a little bit deeper in our challenge. But here's one thing I think I forgot to mention is the risk of dementia is much higher when we're taking these prescription sleep aids and even over-the-counter sleep aids, because they penetrate the blood-brain barrier, which, we have this like casing around our brain that keeps like good things in, bad things out. And certain medicines are designed to be able to get through that membrane, to get in there to do what they want to do. But you can have an increased risk of dementia when we're taking a lot of these different types of prescription sleep aids and sleep aids in general, and especially things like the benzos like Ambien, Xanax, all of that. So if we know that sometimes the root of all of this can be chronic inflammation, we want to see if we can dig deeper and see what we can find that can be helped, right? Is it thyroid? Is it hormones? These are things you can absolutely get answers to. It's not like that's not really a gray area. You can definitely see if your adrenals, your thyroid, and your hormones are off. It's an actual lab test. It shows with sensitivity and specificity what's going on there. So let's see. Before we go off completely, if anybody has any questions, please go ahead and type them, especially if you're seeing the replay. If something I mentioned you want just a little bit more deeper dive to, I'm happy to reply back on that. I also have 9 tips to the best sleep. If you'd like to grab that, you can go over to my website. I'll pop in the link below, and I could send that off to you really easily. And I want to share real quick a story of a gentleman in Houston who went and saw a functional medicine doctor in Houston. I think his story is really helpful. And sometimes just learning other patients' stories, maybe you can find a little nugget in there that's helpful to you. So he's a 40-year-old male who is working for a large hospital group, and he was having trouble with his sleep from time to time, and it kind of became increasingly more bothersome. And he'd been seeing his regular primary care doctor, and these symptoms have been going on for like 12 years. But he'd come in and see this naturopath doctor, and every once in a while he'd mention something about his sleep. And of course, the naturopath would offer a few different things, but he would just sort of say, I'm going to stick with what I'm doing with my primary doctor, fine. And one day he just came in and he was like, hey, can you help me with my sleep? And when the practitioner asked him, more about his history, really for 12 years he had been having a few hours of sleep every night. He hadn't slept more than a couple hours every night for 12 years. So they did a more deep history. They did some blood work. They didn't really find anything in the initial blood work. So they decided to look a little bit deeper to hormones, adrenals, and neurotransmitter testing. And they found that there were some imbalances there for him. And when they corrected the underlying issues with his hormones and adrenals, they basically, within a week, the patient reported that he was sleeping a little bit more. So he was up to like 4 hours-ish a night. And then as they continued on and kept, reassessing the levels and reassessing and kind of tweaking, whether it be with the supplements or herbal remedies, he's now sleeping about 7 to 8 hours a night. So, and there's actually 1,000, a million probably stories I could read over and over to you about that. And this is what, because I've seen it happen for myself. I think it's almost wrong to not bring to light. There are a lot of answers out there if we're willing to look for them. And we don't always hit everything out of the park on the first try, but it's certainly worth exploring more. So if you guys know of someone that has trouble with their sleep, if you personally have trouble with your sleep, I hope this video has been helpful. At least it maybe could be a springboard for you to bring in to talk to your primary care provider. And I think I put up a video, I want to say a couple weeks ago, that had resources to find a functional medicine practitioner in your area if you want to look into that. I do think a lot of primary care doctors, though, are becoming more and more open to functional medicine and looking into it more. So I think there's nothing wrong with jotting a few notes and bringing things into them. And then if you have any questions for me, please reach out to me. And if you think someone might find value in this video, please consider sharing it. And if you'd like I said, you can go to the link below and subscribe to my email list, which I'll send out usually the recap of a longer video like this a week. I'm also going to be bringing out some really short, like 2-minute tips on health seekers, which I think will be really helpful, and of course a lot quicker than these longer ones. But it's hard to get a full concept down on something as deep as this topic in 3 minutes. But there are some other things that we can get out pretty quick. So if you guys like this content, consider going over to my business page, Jenn Rice International. I do put a little bit more over there as far as articles and things that you might find of help for you. All right, you guys have a great week. Talk to you soon.